So let's have a summary over the videos that we have discussed for qualitative disorders of platelet. So we have discussed about the structure of the platelet, where we have discussed about the receptors and the granules, and then deficiency of these these receptors and granules will lead to which kind of a syndrome, or what is the condition called. So we have discussed the classification of platelet disorders. We have quantitative and we have the qualitative. We have hereditary and acquired and qualitative. So qualitative disorders of platelet function produce defects in the formation of hemostatic plaque, and it will result in bleeding. So the bleeding time will be prolonged, and then platelet count will be normal, because this is not a quantitative disorder. This is a functional disorder of platelet. We have the classification here. We have the hereditary disorders of platelet addition, Bernard-Sillier syndrome, disorders of platelet secretion, storage pore deficiency, or gray platelet syndrome. And we have disorders of platelet aggregation. We have Clansman's thrombostomia. And coming to acquired, we have drugs, renal failure, and hematological malignancies. So this is the diagrammatic representation of the functional disorder of a platelet. We have two platelets here, GB2B3A fibrinogen, which gets attached to the receptor, that is GB2B3A, and deficiency of this is found in Clansman's thrombostomia. We have the GB1B9, which is the receptor for 1-Willigen factor, and this deficiency will be found in Bernard-Sillier syndrome, which will be followed by 1-Willigen disease. And we have the alpha granule deficiency in gray platelet syndrome, and dense granules deficiency of dense granules, that is storage pool deficiency. So for defects of adhesion, two factors are important for adhesion. We have the two factors GB1B9, and we have 1-Willigen factor. So this will lead to the conditions called Bernard-Sillier syndrome. We have a deficiency of the glycoprotein complex 1B9, and then 1-Willigen disease, because the receptor GB1B9 is missing, hence 1-Willigen factor does not go and combine with the receptor GB1B9. And then disorders of platelet secretion, we have due to the absence of granules. It could be either alpha granules or dense granules. So for alpha granules, we have the gray platelet syndrome, and for dense granules, we have the storage pool deficiency. And for the defective platelet aggregation, we have a deficiency of glycoprotein 2B3A. We have the glycoprotein 2B3A over here. So fibrinogen gets attached to these receptors, but hence this receptor is absent, so fibrinogen does not get attached. So the formation of breaches is not maintained between the platelets. And for acquired, we have drugs, most importantly aspirin, and for renal failure, and for hematological malignancies, we have the myeloproliferative, neoplasms, and myelodysplastic syndromes. So that's all about the qualitative platelet disorders, or functional disorders of platelet. So I hope you have understood with the video. Thank you.